Welcome back to the Femme FC Podcast. On today's episode, I have Copa, who is a physical therapist from Houston, Texas. She was educated at Texas Women's University School of Physical Therapy and at Memorial Hermann Ironman Rocket Sports Medicine Center Sports Residency. Since graduating, she worked at a Memorial Hermann Rocket Sports Medicine Center clinic in the Houston Medical Center, collecting data for a large knee postoperative ACL database, and teaching in the residency while caring for orthopedic patients of all ages and activity. She began working with the Dash in 2019 part-time and transitioned full-time in 2021 and is currently the head of rehabilitation and return to play. Copa, thank you so much for being on.
Thank you so much for having me.
Of course. So you want to start by maybe just telling me a little bit, telling us a little bit about your role with the Houston Dash and how it's evolved since you've started there?
Yeah. So like you said, I started in 2019. The Memorial Hermann Hospital System had a contract with them, and part of the contract was to send a physical therapist for a couple hours a week. And I got selected, and pretty honored to get to go. So it was super exciting. So I did that for about 2 years through all the COVID stuff and in and out. And then by 2021, they were looking for either an assistant or a full-time physical therapist, an assistant athletic trainer. And I was like, oh, I'll come do some assistant work and, the PT work as well, and just see what working in a team could be like. So transitioned into that in 21. And then it's kind of changed over the years as different personnel kind of come in and out. Sometimes we have less return to play personnel available, sometimes more. So the role has kind of changed a little bit, but overall the bulk of it is doing the long-term rehabs and the return to play portion, or the planning of it at the very least.
So you recently received a lot of media attention, and I know last year at Isokinetic, you presented some case studies on some athletes you worked with postpartum to get them back to return to play. So that's really what I want to kind of dig in with today. So first, do you mind just talking us through maybe some of those cases and how you kind of developed your framework for getting players back to performance levels postpartum?
Yeah, it's kind of funny because there's been a couple like media things that have happened, and I kind of laugh, and I'm like, honestly, I was very fortunate where I had 3 back-to-back cases. So that really helped to have 3 in a year to even have some input. And it was right before this whole new surge of postpartum information has come out. Because I think in the last 2 years, there's been such a nice amount, and different leagues are starting to write their handbooks and their recommendations. So as I was planning for our first mom to come back, there wasn't as much. There was a couple of things out there to base it off of. So starting that whole process was kind of interesting, trying to gather bits and pieces to make something that would work for soccer specifically. There were things there about lifting and returning to run, some case studies on some Olympians. And of course, there were soccer players that have returned back after having children. So, it's very obvious that it could be done at a high level. So it was making a framework that worked, and maybe could be reproducible, since there were going to be 3 on our squad. So the 3 cases were all interesting because they were really different, and that's, I think, what is interesting to think about is every single one is probably going to be a little bit different, and you got to kind of roll with that. Whether it's a C-section or a vaginal birth, there's going to be some nuance to that. And then also I think each mother should have the right to kind of decide where they're going to spend their time. So, some of them wanted to leave market to be pregnant and be with their family. Some wanted to stay, train as much as possible. So each scenario in the pregnancy part and in postpartum was a little bit different. And then I also think it's important for them to sort of decide when they feel comfortable coming back. And so each person picked almost a different time frame. So one person came back 4 weeks after, one was 8, and one was 12. So these cases were all a little bit different in that way. And of course, their birth experiences were all a little bit different. So without going into too much detail there, it's just part of the process is to know that there's some individualization there, as it should be sort of for every injury, but these specifically process wise, to let them sort of have their experience. And I mean, I didn't know what to expect either. I kind of joked that we were all first time moms because, I had to kind of like be like, all right, we're doing this together, but I have some things to learn also. So they're very gracious about that. So the whole process sort of for me was like, okay, what is happening when they're pregnant and when they give birth? And because you almost have three things to think about: when they're pregnant, when they give birth, and then after. Like, what are the physiologic changes? And then see how that would dictate their reaction to exercise and intense exercise. So there were some good courses out there. Herman and Wallace had a good one. Ice Physio had some stuff, and then of course different research articles. Maggie Davenport in Canada, she was big, had a lot of different resources, so just read up on whatever she had and kind of followed all that. There were some recommendations given by the British Journal of Sports Medicine that were pretty helpful as far as like when to start each exercise component, and then just kind of following the pelvic floor sort of ideals after pregnancy to get everybody ready. So a lot of prep and learning on that side. And then they came in, then it was like how to build, once we get sort of the foundation in, the actual return to play. And it wasn't I mean, it was very enjoyable because it wasn't actual, like, once, you feel like everybody had healed and sort of kind of recovered from at least the birth part. It was kind of like just building up, and then just seeing how the reaction would go. Cause like, I hadn't personally worked with, I could read as much as I want and know in theory, but to see how everybody react. And moms are very resilient. And I feel like I would joke and be like, is your pain tolerance different? Like, should be more tired or more sore? Or, so there was a little bit of that was kind of fun. Because they were so excited to be there and just so resilient. So, it was just kind of basing the how to build their volume and how to build their exposures in a way that took into account all the changes that had occurred, not just pelvic floor wise, but knowing that hormones were different. Their fueling needed to be different. I think the thing that I learned the most, or one of the things that I wish I'd done differently, was be more intentional about the fueling piece, because their energy was put in a lot of different places, but especially for those that were breastfeeding, although there's like no correlation, I think, at the moment between breastfeeding and injury risk, there is a correlation between breastfeeding and the need for an increased caloric intake. So I think, going forward, I'd probably be a little bit more intentional, but like, all right, I know counting calories is not something, we tend to focus too much on, but if you're breastfeeding, that might be something to make sure we're getting the allotted amount, to mitigate the risk of fatigue that turns into maybe soft tissue injuries. And we did find a lot of that along the way, because they were able to push really hard for whatever I think they felt pretty good, and then they were like, oh yeah, I'm starting to get really tired, and it would just be like a sudden wall. So definitely thinking about fueling and the main recovery pieces in between each of how we were putting them through the exposures. So that was basically how each case sort of came about, is like, all right, what did you experience? How was your pregnancy? What did you experience after birth as far as like tissue involvement? What did we have to wait for that to heal or recover? And how could we best push that along, like any soft tissue injury? And once those timelines were sort of satisfied, like, how do we build for you personally? What are you feeling? How are you recovering? And how can we prepare you best for what happens? So I didn't really, how like ACLs, you're like, okay, by 6 months, maybe we should be out there training and like getting into some contact. And by 9 months, maybe you can play some games, or 12 months, or however you have like the end date in mind. And this one, there's no end date, because I wasn't quite sure how I was was like, great, we'll start at 0% and we're going to increase 10% a week, and just make sure your body enjoys that. And we'll start, it seems reasonable that you've completed this much strength training here, so that we can start jumping, and then we can start sprinting, and like based on like the fundamentals of strength and conditioning and building that you do for anybody. And that seemed to work. I would say that just going 10% was good though. Like sometimes I think in some cases you can, some people will increase by 20% or like move the needle in different places, but 10% seemed to work pretty well. And almost you need to like repeat a week or two, depending on fueling or how they're feeling or how they were sleeping, how the baby's doing. And just kind of taking each week sort of as it comes and not putting too much expectation on, okay, the next week must be 10% more. And then that way you can sort of like take and give a little bit there. So each case was sort of based loosely on this 10% increase. And we found that they all worked pretty well with that and were able to get back at the 4-month mark with pretty good fitness. Maybe not 90 minutes, because when we returned them back, we would start with like, okay, you're available for 15 minutes, and then 30, and that kind of that normal segue that whatever your performance staff sort of likes to use. And yeah, they all got to start and play, and it was really, really exciting.
And so can you take us back to like the giving birth phase, and what's your first intervention, or what's the first focus or priority really early in that, acute stage, we would call it, of like right after giving birth? There's still some tissue damage. Of course, difference between C-section, vaginal birth, and then different levels of potential tearing with the vaginal birth. So what is your approach to that early stage after giving birth?
Thankfully, it's like thinking about it like any soft tissue, or because it's like muscle injury, right? So, and they basically grade it for you. And thankfully ours were very low grade, just like, the best it could look after, I think. So I haven't had to experience like a very high grade, like muscle tearing. So going off of that, it's mostly like how you would do with like the muscle, like a hamstring or quad. We just started with some like isometrics, or can you feel, your pelvic floor and the core muscles, can you feel them moving, and can you activate them? So let's make sure that that brain to muscle connection is there. And so we started with a lot of just like awareness of the pelvic floor, a little bit of mobility work, and just sort of in like stationary sort of things, so that we could eventually move it into the dynamic. But yeah, in that acute phase, it was very much like, let's find these muscles and let's make sure that they're working, and then you can cue them yourself.
And is pelvic floor physical therapy and pelvic floor health something that you had previous experience with, or a background of education in? Was it something you had to go and it's like, hey, we have these pregnant players now on our team, I better upskill myself? Did you have any, you talked about some of the courses that you took, but what are some resources? Because obviously within a women's soccer team, the resources are not that large, right? And so we have smaller staffs. There's not a specialist for everything. Certainly teams can't afford to hire a full-time pelvic health specialist. So how did you, or what would you recommend to other rehab and medical professionals in a women's sport team, in a women's soccer team, for getting that information and that knowledge to be able to apply to a postpartum player?
Yeah, I definitely had to upscale. I'm not like trained, especially in pelvic floor therapy. I think we had one class in school, one session in my residency, so exposed, but definitely not, educated in it. And I will say that like for all of them, we advocated for them to go, even if it wasn't like they had symptoms or anything. We're like, hey, like we want you to go out and seek like pelvic floor rehab, just to get an evaluation. That way, if we ever need them, or as we're on this journey, like if we need to use that resource, like we want it to be available. So yeah, for sure had to work on it for myself, which was good. I think like it was, you should always push yourself to get like a new skill set, and I think in women's sports, hopefully now that's part of our curriculum, or that's part of like the league expectations, and that they provide for practitioners that are there to learn those things, instead of having myself to go and find the best route, and I'm still looking for the best route. Hopefully the league and everybody involved will sort of have this like, hey, like this is the bare minimum, is to actually know, some of the stuff. But all that to say, I think the biggest resource, I started with Herman and Wallace. I had talked to a couple of PTs that I worked with. I still work at a clinic, and so there were some pelvic floor specialists there. And so they suggested some that weren't quite getting credentialed in pelvic floor. They were just adjacent entry-level classes, and a lot of them had to do with like pelvic floor or the postpartum athlete, things like that. So anything titled postpartum athlete, I was taking those courses. And then of course at the end, they give all their references. So I'd go and find all those articles and and see who was citing those articles, and then I'd read those person's articles, and I would just like kind of rabbit trail my way around to see like I'm gonna get everything out of this one course that I can. So I'd found that's how I found the names of the people that I wanted to keep reading up on and refreshing my knowledge. So Herman and Wallace was really good. There's a set of, I think they're doulas, and maybe one is a nurse, called Mama Stay Fit, and they're on Instagram. And so I know everybody's like, okay, hold on the Instagram stuff, but they were recommended by the Herman and Wallace instructor, and they have a bunch of courses that they've put out, and they were geared more towards combat because they were both in the Army, and so that when they had their children, they were trying to get back into, their return to combat. So they put out a couple courses that were super helpful. And then, just keeping up with what the other leagues are doing as they're hiring experts to come and build their, handbooks, and so to speak, like seeing who they are, seeing their research, trying to reach out, seeing where they're speaking, and trying to kind of get in the spaces that they are. And that's basically how I sort of built my own little curriculum on how to try to do this.
Great. So what were some of the key learnings that you took regarding that early phase and regarding some of the pelvic floor stuff that you had to go and do a lot of work to learn about and upskill in? What were some of the main things that you took from those courses that you're like, oh yeah, I can apply this with my players?
One was knowing what happened to the body physiologically while they were pregnant and after birth. So knowing what changes happened to your systems, cardiovascularly, hormonally, musculoskeletally, like knowing what happened there, you could base your exercise routine kind of off of those things, or how much to push, or when to know when to pull back. So any information on the physiologic changes of every system that happens in the body, I think was helpful to set the framework. And then when it came to exercise selection, I think, you use your pelvic floor in a lot of things. So it's about cueing and getting them to recognize it. So, I mostly worked ACLs for the first part of my life. So I put everything back to the knee. So this is maybe not the best thing, but you do quad sets at first, and you have to get this quad firing in the right thing. So, that's where I started with the pelvic floor. But then it was like, I know how to cue a quad, and you can see it. So like how to cue the pelvic floor, I think was the big thing. Like a lot of people talk about the blueberry sort of thing, and then the elevator one seems to be the best one. So getting the cues on how to talk to them and get them to engage their pelvic floor, and that way you could just use that in any exercise that the pelvic floor had to be involved in, I think was a big takeaway. And then just the general ones, like, okay, like in order to progress to jumping and impact, the pelvic floor has to be able to do this. So the precursor exercise would be XYZ. And then lastly was before, two of them stayed in market with us and worked out with us before they gave birth. So we did a lot of birth prepping stretches, and the idea of like getting the pelvis to actually like work through all these different quadrants was super interesting. So we do a lot of like at the end when they couldn't really like run as much, and we had to be careful about like how much lifting they were doing. We would do a lot of birth prep like stretches and exercises, and I like to think that helped, and that's maybe one of the reasons we had. I do think they say that women who exercise, their birthing, like the stress of birthing is a little bit lower anyway, but getting them to be able to kind of like mobilize through their pelvis and get the breathing exercises down, those were all pretty helpful to learn.
So what were you mentioned some of like, learning some of the physiologic changes that happen. What were some of the key changes that you learned about that happened that informed your exercise prescription or interventions or programming?
Especially while they were pregnant, it was the idea that your blood volume is going to be a lot bigger, and the consequences to the stress on your heart, because the symptoms to keep, what you're looking for to make them stop exercising is like dizziness and all this. So it's like, okay, why are they getting dizzy? What's going on with their blood pressure, and what can we track to make sure that they're safe? And their blood pressure is going to be different because a lot of the hormones create relaxation, and not just in, the muscles and the connective tissue, but your vascular system is also connective tissue. So because there's more pliability in their vascular walls, their blood pressure gets lower, so then they get dizzy and have more tendencies for syncope. And then, of course, there's more blood volume going on overall, so your heart has a little bit more to deal with in that way. So their heart rate's going to increase and decrease. So you can't really go based off their heart rate and their blood pressure to say whether you're exercising too much. It has to be their overall like perceived rate of exertion. So that was good to know, and knowing that like any sort of like lightheadedness, big drops in blood pressure were big signs to kind of slow everything down. And then I think so I think mostly like the heart stuff, because I was like the more like, okay, like some aches and pains here and there and some back pain, like, we can deal with that, but we just want to be safe for everyone. And then the other thing was like knowing what the baby's kind of doing while the mother's exercising. So their heart rate's also going to increase. So they have a higher capacity for heart rate, so it's fine if it increases a little bit, but also just knowing that like getting them into a lot of like tachycardia is also probably doing that to the baby. So just being aware of like their heart rate, although will be higher, we just don't need to be getting into these like red zones while they're exercising. So getting an idea of what their heart and lungs were doing, because they also hold on to more carbon dioxide. The transfer of carbon dioxide is a little bit poor, so they can hyperventilate a little bit sooner. So their breathlessness can come sooner from that round too. So a lot of like, can you just keep your breath? Like your exercise should be at the tolerance where you're able to kind of talk still and not get breathless. So yeah, a lot of those physiologic changes sort of like designated what we were going to do and what our goals were for the week, knowing that in each trimester that might change a little bit.
And then the second thing you mentioned was cueing for the pelvic floor. We had Emma Brockwell on the podcast earlier on in an earlier episode, and she said something that I didn't know, that was that the pelvic floor actually acts as like a trampoline, and you kind of referred to that as well. So what specifically are you looking for the pelvic floor to be doing during activities like bracing during lifting, or kind of like acting like that trampoline, maybe during like plyometrics or during contact? What is it that the pelvic floor should be doing, and what cues are you giving athletes to ensure that that's happening?
I still think I'm refining my technique or what I know about it for like, especially like plyos and sprinting. Like the idea of getting this like, okay, can you lift and go? Can you do that while you're like, what is it doing when you're sprinting? Although like we know like when the foot impacts, it's going to like brace and have a little give. And a lot of people have talked about it almost like the supination and pronation of your foot. Like it's going to, as you need some pronation to sort of absorb that force, but you need to pronate again to create that stable base, or supinate again. So knowing that is like, okay, that's a really good mindset for me. Is like, okay, we can do this slowly now. We can do this in a squat in a land, like a squat jump in a land. We can do this with some single leg hops. And then from there, I'm like, hopefully you transfer that into sprinting. But I think some of it is just seeing the consequences of the pelvic floor not being there. And that would be like mostly like incontinence or some sort of like hip and low back pain and things of that nature. So I think I'm being a little bit too reactive. So I hope like somewhere in my education, I get to learn how to bridge that gap, or I don't know, maybe that's enough to your body like cues itself enough. But thus far it's worked to be able to be like, okay, in some of these controlled like hopping measures, can you, we do your pelvic floor exercises, can you put that into your hopping? And then when you go out and like play and sprint and go through your workouts, are you having low back pain? Are you having hip pain? Are you having incontinence or stress incontinence and things of that nature?
Yeah, I think that's a reasonable thought process, because you don't necessarily want them thinking about what their pelvic floor is doing while they're playing.
Correct.
And so like you're saying, it's training it in controlled ways during activities, and then hoping that transfers over. And I guess that it does if there's no like urinary leakage, or like you're saying, low back or hip pain or other manifestations of pelvic floor dysfunction. So I think that seems reasonable to me with my limited knowledge of this.
Yeah, that's what I'm hoping. And, I'm always like looking out to see, some of these connections that go. But I agree. Like I think that sort of happened with like the core bracing and all that stuff, where it's like, oh, people started like And then you can do that. You can get too much tone in your pelvic floor and not let it be pliable enough, which will also let it, increase leakage and low back pain and all those things. So to have a happy medium. So my goal basically that they know where their pelvic floor is, they can feel it and they can maneuver it in their, activation sessions or in their lifts and things of that nature. And then their brain is going to start like using it as it's designed to be used.
Okay, so that's kind of the earlier phase of it, is allowing, tissue to heal essentially from whatever type of birth they just went through. And then comes, okay, now let's start working on pelvic floor. Whatever individual factors need to be addressed, as you're saying. So then how do you start? I know you mentioned building up by 10% each week. What exactly did that mean for these players in your team? Was it on the field, in the gym, both? How were you measuring that? How did you, essentially, what objective metrics, or what was the 10% increase each week? Volume, intensity, both?
Yeah, I think it's a good question because 10% is a little vague, but I had this sort of idea like, okay, when you first come to market to see me, we're going to have our first day as a screening day, and it'll be at that time point when you would be cleared for exercise, both from your from a timeline perspective, from a healing perspective, and then of course your personal physician should be saying like you're ready for this. And then I would do normally like a movement, or have our team docs kind of check them out, say that they're looking good from a internal medicine perspective. And then I say, we're going to do like a movement screen, which is just a re-entry lift. So first I'll like kind of check some joint mobility and maybe like a normal movement sprint, just to make sure everything looks decent and ready to lift. And then I have this sort of re-entry lift that sort of tells me how they do a hip hinge, how they do a squat, how they do single leg balancing and single leg like step ups and downs, just some basic sort of things. It's nothing fancy, and it's nothing as far as like an FMS or anything. It's just like a lift, and let's see how you feel and how you're moving, and if I can kind of like eyeball some stuff, and that will tell me like, and how sore you get is going to tell me like how we're going to progress this. So that's the starting point. And of the first day that they come and see me is just a lift. And then the other thing is, if they're cleared to begin running, I'll like check on some core stuff, maybe do a little bit of strength testing, and then we'll begin a normal return to run program. Almost like the same as, basically I used what I did for my ACLers, because they've almost been out maybe longer than an ACLer. So, but at least it's like very baseline. I don't have and I think their joints are a little achy also. So using that method seemed to be helpful. Like, okay, taking into account that their joints are going to be achy because of all the relaxin going on, and all their cartilage and soft tissue is totally not a running cartilage and soft tissue. We got to like expose them to get some of them back. So it's usually like one of those minute on, minute off sort of things. And then I would tell them like, we're gonna work on this 3 times a week. You're gonna lift and rest and recover from the lift. Then you're gonna run, and then you're gonna rest and recover from the run. And then we're gonna do like a mini combo day of both and get your body used to doing both things. So we started with like 3 days a week with the idea of like physiologic recovery, and let's see how you do. If you can recover in 2 days from what I've given you, we're good. And if you haven't, that means this is where we're at as far as like your tissue accepting. And then we can kind of suss out like what's they're reacting to. And from there, that's where I would kind of build up the 10%. And so I would say that they had to lift a certain amount of their body weight and achieve those goals. They had to be able to tolerate at least a mile of running or 10 minutes of running. And then from there, we could start some easy like changer. So I didn't go intensity until a little while. I just changed the movement patterns, and we went like, okay, let's start some change of direction, nice and easy. Let's get those movement patterns down. And then, so each week sort of had a theme of what we were going to work on, and everything was sort of low intensity. After about 4 weeks, I think, is when we started to add like sprinting. And we had done sprint mechanics as part of the lifts and as part of some of the movement things. So we worked on mechanic things going forward. But as far as like putting some real oomph into it, I felt like, okay, from a normal thing, like if you put the human bodies through something for about 4 to 6 weeks, it starts to adapt and be ready. So that was our decision to start like working on the sprinting, and we would do that once a week as our intense thing. And then that was the time when we started like conditioning for soccer. About then, it's like, all right, and then we have a conditioning day. And I think you can maneuver those variables, maybe depending on the athlete or how you personally like to program. But that was kind of like how I was comfortable, sort of like, I was basing it off on like ACLs and Achilles like how using that sort of idea and framework and scaling it a little bit to what they had going on, and that worked. So it kept them safe, because there was an instance where you could easily overdose on the high speed running and all of that, and they, not that anything crazy would happen, but a muscle injury was, if that occurred, that was the difference between them making, maybe a camp that they were trying to get back for, or a game that we had set up, and that would help them, their career a certain way. Like, so those kinds of things. So starting in that way, where I knew I was like, I can predict the outcome of next week and next week and next week. That was the thinking behind all of that.
And you said that they're doing, a day of training and then a day or two of rest, doing 3 days a week, allowing for that recovery period. Were you tracking like subjective wellness during this time, or how are you measuring their response to the training as you were going through it?
I wish for scientific purposes I had like been like, okay, they came back and they had a whole, because we do have wellness that the whole team does, but I was basically checking in like, hey, like, how's your soreness? How's your like energy levels? And then did you sleep pretty good? How's the baby? That kind of thing. And then, like I said, I also wish I had done a little bit like, did you fuel after you breastfed, or because this is where I learned it. Like, you learn some things the hard way. We were plateauing with one of them, and I was like, okay, like, something's going on here. Like, tell me about your morning routine. She's like, okay, well, like, I pump in the morning, and then I get here. I was like, well, when did you eat breakfast? And she was like, well, I usually eat it afterwards. I was like, because I hadn't had time, because I got to get, baby to daycare or whatever. I was like, aha. So, like, your timing is not ready for training. Like, that's why we're kind of plateauing here. So we came up with a kind of calorie bomb sort of situation, which in her case was something that she could drink because it was quicker and she could do it on the road. So like those kinds of questions I think could be much improved the next time I go about this. But it was basically like the check-ins of like, what's your soreness like? Can you rate it for me? What's your energy levels like? Did you sleep? Like, and then we can kind of tell like output wise, like, watching them lift and stuff. Sometimes I knew I had to scale back anyway. I'm like, all right, like, you're looking pretty tired, or you're looking like, you think you feel a certain way and you want to try this day, but we might have to go back a little bit. But yeah, so I think putting them on the wellness questionnaire, I could have like maybe quantified or done a better data collection of that, but that's usually how we tracked it.
It's funny to think that, with the rest of the team, we ask them every day about their sleep quality and quantity. And new parents famously get no sleep.
Yeah.
And
yeah.
so that's such a big consideration during the rehab, is like, no, they're not sleeping. And it's not something that's like, oh, let's improve your sleep hygiene and let's talk about temperature of your room. Like, it just is what it is. Like, they have a human that most cases, like early on, they have to wake up every 2 to 3 hours to feed. And so it's like, yeah, no, I didn't get sleep, and there's no way to change that.
Yeah. And some of it was just like being okay, like, did you actually sleep less than what you normally did, which is little, like, because sometimes they'd come in and be like, he did not sleep well. And I was like, well, I feel like he was up all night all the time. But there was like a change where they were like, this was not a good night. And I'd be like, you know what? This is why we had our off day for tomorrow. Today's your off day, and we're coming in. So like plugging in some of those times for exactly those scenarios where it's like, there's nothing we can do but try to get some of that sleep, like maybe back again, and like sending you home to try to rest. And that was okay. That was kind of like expected. I think it disappointed them sometimes to be like, not do the thing that was planned for that day. And I was like, no, this is all planned, because like I have no idea what's going to happen. And I think we need to acknowledge that rest is the key part of building, for where we want to go.
That's such a good point. And I think that gets overlooked in rehab in general, is that the recovery is just as important as the stimulus. And you're not going to keep developing that physical attribute you're chasing if you don't allow your body to recover and adapt appropriately. And that certainly applies in postpartum cases, probably even more so than a standard musculoskeletal injury. Yeah. And so I'm wondering if maybe in the future there should be like a different wellness questionnaire for postpartum moms who come back to sport
Yeah.
and are like during their rehab and return to sport.
Yeah.
Okay, so you talked about the early stage and you talked about kind of the programming and how you're progressing it and timelines a little bit. What was your way of looking at and assessing their readiness to do things like return to team training sessions, whether that was modified or not, return to contact, and then eventually returning to games and competition?
We used like what their old output was, and then I kind of like I took that with a grain of salt because we kept getting new coaches, and it wasn't like their output from last year was going to apply because this new coach for this new position was asking XYZ. So I kind of like I took a little bit of like what they could possibly do before and maybe what's going to be required of them going forwards and try to kind of like suss out a good number. But we used overall distance, even though that kind of metric is just, it's a little vague. We definitely used HSRs because that's where most of the injuries are known to occur. Their sprint speed was something that was more performance measure, but I could go to coaching and anybody and be like, all right, well, she's fast now. Like this is a known measure, especially in certain coaches where it's like speed for this position is going to be like, I just need them to be fast. And then it was almost like the amount of exposures to technical work, possession work, and then we would do like planned contact. So I have a really lucky to work with a really good performance coach who has these contact drills where he does contact with them first, and we get kind of this idea of like what contact would feel like, and then they feel confident going in, and it's just like a mini exposure before the real exposure. And so we got all those checks boxes in. Okay, like you have to have a certain number of technical sessions in with the distance that your teammates are also getting. So if they're getting 2,800 meters on a re-entry day with technical work and a possession drill, you've also done that individually. And maybe you had to stop a little bit, and maybe it wasn't at this, we could, you can see the rate of output maybe was a little bit slower, but at least if we're close to that, then you're ready to kind of get back into there. So as long as we were matching some of the team metrics, we would put those in. But the main goal was to get to 80%, and in the end I went with what the position required, and just kind of compared it to what their old output was. And when you're within 80% and you've done technical drills, possession drills, and some contact in individual sessions, then we can start doing reps with the team. And that's when the handover to performance would begin, because in theory, like they've gone through all their strength testing and passed. They've reached at least 90% of their sprint max, and they can do that like 2 weeks in a row. And that's an arbitrary number, but if I spent any more time, like I don't know how long I would have to keep them out for, And then and some of the HSR measures, not fatigued and then under fatigue. And then in my mind I was like, okay, if I put them out there, what's the worst? That's like, where are we going to find trouble? Like, not in the technical drill. So it's we have some confidence this is going to look good, and I have some evidence to back that up because they've done it individually. In the possession drill for this many minutes, like with where they're at, like, so it was mostly like, where's trouble going to be found? It's going to be found in probably the 11s and maybe some intense small-sided games. And so we worked up to that point, and then just slow reps, which I think is pretty fair for like most ACLers or long-term out. That's how you kind of go about it. So that's kind of how we went about it, as long as they felt they had the exposures individually and their bodies were recovering from that.
So you're taking us through the physical preparation and knowing that they're ready from a physical perspective. There's a lot of talk in like ACL rehabs about the psychological readiness. I can imagine, I don't have children, but my sisters do. I have friends who do. And I know that returning to work after your maternity leave or family leave is over is a really difficult and emotionally and psychologically trying time. I would imagine that that's also the case. These are athletes returning to their job after giving birth. How did the athletes do psychologically with time spent away from the baby? Could they bring the baby? How did they feel about returning to the team, returning to training, returning to competition? And were there any specific things you guys did with them to address the psychological aspect?
I think it's a great question, and I think I hope that somebody asks like their perspective a little bit. I think there's been a lot of celebration, which is wonderful, and I think they've leaned into that. But I do wonder because, even with me, they showed me the best sides of themselves. And they wanted to work hard, and they were so excited to get back. So I got to see all the positives. So I'm sure there was some, and I know there were some days where we were like disappointed because we couldn't quite do this, that, and the other. So there was some, but that happens with almost any long term. So I think as a rehab person, you're kind of like, you're ready for the days that like maybe didn't go as planned, and we can talk about it. And there's always tomorrow, and we have, that's part of our skill set is talking through that. And that's part of the joy is like, okay, even on the hard days, we're here, we're in it. So I saw the best of them. I always welcome them to bring their babies. Always, always. My dream was to hold the baby and yell at people to go play. Like, that is my dream. And I got to do it one day where the caregiver couldn't be there. And I was like, I'll hold the baby and you exercise. And so we definitely, the medical staff and the performance staff, super welcoming. We wanted the babies there all the time if possible. We would push them around in the little prams and like whatever they needed, and hopefully that was helpful. Our facility is not geared for babies, but we did the best that we could and set up little playpens and as much as we could to help and get them there. And I think our team was also, as a team, just loved having babies around, and it was fun to see, like, there was almost like this jealous, like this whole thing, but who's the baby gonna love the best, and who would it choose today? So there's this whole culture around it that loved the baby. So I hope that it was a welcoming place, and we traveled with the babies. They were part of our year, for the last 2 years, and I don't think we would have it any other way. So as far as the psychological piece, they probably have a very unique story to tell. From the other side, trying to help them through it, I think, trying to be welcoming, trying to, give them the space to parent how they want to parent and still help them out. I think, we were all super honored that they would want to bring their babies around us. And anytime they want to do that, I'm more than happy. I think it's great. So.
Yeah, exactly. So you mentioned earlier that if there is something that you feel like you would do differently or include next time, it would be looking at the fueling piece. Are there any other like kind of main takeaways or maybe things that you learned from like the first case to the third that you saw in the first case? So you're like, oh, okay, on reflection, maybe I should add this. And then the next time you added that, any kind of key learnings or takeaways or just little like clinical pearls that came up during these?
We learned a lot from the first to the third. So to our first mother, if she listens to this, thank you for letting us learn on you. But I think the first one is in the first, like, until they have a certain amount of tissue resiliency, I still think some like medical personnel being present is key. So even if you have a really well-versed I think it's good to keep, I know there's always like a little bit of when does the performance person take over and start making them better, faster, stronger, and how long should a medical person keep them? And that was a big question that we had at first to decide when would that happen. And I think until the resiliency of the tissue is there, and it took about almost 3 months, which is not unheard of, like a 12-week cellular turnover. That seems pretty key for almost every soft tissue situation. And also getting to the 80% of what we were asking them, because then that 80 to 100 could be working on some of those performance attributes. So I think knowing when to stay involved was good to keep them healthy and like have less setbacks. So that was one thing, to keep the partnership together until maybe closer to the end. Even though performance worked for them for the most part during like the 70 to 100% mark, I would say that until that tissue resiliency is there, just keep up with them in that journey. So that's one. And then two is for sure the fueling. And then I think I should have done a little bit more of like collecting some interesting things, even though I wasn't sure what it would mean. So I would have probably done a little bit more like blood pressure and heart rate. Not sure what that would have done for me, but I think I could have tracked it across the way, maybe seen like, okay, while they were pregnant at the very least, because those were some like, how is your heart doing and how are you doing with exercise sort of things. And then, so like kind of following, while they were pregnant, some of those metrics so that I could better plan like their exercise, or maybe foresee like, okay, we're getting close to where we're not doing like as much hit stuff. We're doing like steady state, and making like some goals. So maybe I could forecast some of that a little bit better by seeing how their heart was tolerating all that. I think your point about the wellness was pretty interesting. I think tracking that along with their exercise could let us know, also be some forecasting and let us know like how we're doing week to week. And then that could just really objectively tell you whether you're doing a good job with your programming. So I think those tracking pieces, I would probably add a little bit more now that I know what I want to track. I think before I was like, I could track everything and got overwhelmed. And I was like, now I'm going to track, like, I'm just going to hope we're safe. So I think I focused on the basics, and now I think I can go out and get a little bit more information. I think following them through for the full year afterwards, I think would also be something I could have done better, or I would want to do more, because in the, they finally got out there, they were playing, and it felt like they were part of like the team and everything, but I don't think and I think we know that their bodies aren't kind of like regulating back to, it takes almost like a year. So, and especially if they're breastfeeding, there's things that are still going on. So I think we tracked most of them until the breastfeeding was over, and then we're like, all right, we're back. But I think supplementing with pelvic floor, checking in on the health of their pelvic floor, and even like their bone density, all those things that could be different still. Because even though they weren't showing crazy signs and symptoms of anything in particular, there was no red flags, I still think checking in and tracking how they were doing up to a year after would be good.
Okay, well, Copa, I really appreciate this conversation. You gave out so much practical and applicable knowledge just now, but I can't let you leave without answering my 2 rapid fire questions that are more like fill in the blank or finish the sentence than real questions. So the first one is, I wish everyone working in women's soccer knew this about return to play postpartum.
I wish they knew that they were very tough, and I think people are getting a sense of that, but it's not like an ACL where we're worried about like a little graft being safe, and it's not like we're sad because we had an ACL. Like, it's a happy time too. So it's fun, and they're so tough, and it's a really good puzzle to work with.
That's such a good point. I didn't even think about that it's, most rehabs, there is that emotional like component of like some negative emotions and sadness. And of course that like everyone experiences the full spectrum of emotions, but like ultimately it's a happy thing. Like, you had a baby, there's this precious little baby now. And so that's a really good point. I didn't even think about that. Okay. The second rapid fire question is, my favorite thing about working in women's soccer is?
My favorite thing about working I laugh every day. Somebody finds a way to make it good, which maybe in men's soccer that happens too, but I think there's a special bond that you can, as a female practitioner and with female athletes, that you make just trying to make this work. So yeah, I think, as much as, we're trying hard for them and they're trying hard for themselves and for us, like, we're still growing this thing, and we're not getting it perfect even 10 years later. But I think this growing of something together is super, it's fun. I really appreciate the relationships and the laughs that we get every day. We're doing something different, we're pioneering something different. And so that's fun to do.
I think that's such a good point. Like in women's soccer, oftentimes, I know in the NWSL, this is true. Sometimes things happen that you're just like, what? Like, what?
Yeah.
And you have no choice but to laugh about it.
Yeah, literally.
Well, Copa, thank you so much again. And where can people get in touch with you or follow your career and learn more from you?
I am on Instagram, Ax936, and then I'm on LinkedIn. And I'm happy to connect on both places.
Excellent. Well, thank you so much for being on.
Well, thank you for inviting me. I had a good time.